There is a ton of noise regarding government spending, DOGE, and potential cuts to adult Medicaid dental benefits, along with other potential cuts as the budget is still way off the rails. In this video, I want to highlight some figures from 2022, 2023, and also expand on the potential ramifications if adult Medicaid benefits are cut, because the costs are pretty severe. And when you take in how much more expensive it is to go to the ER for dental pain management versus going to the dentist to actually get procedures done and get the decay or infection removed. And I think it's going to be pretty startling what you guys see. So in 2022, the US spent approximately $165 billion on dental services. That sounds like a massive number. However, that is only 4% of total national healthcare expenditures in 2022. So healthcare is not sucking up much of the budget at all from a percentage standpoint. Government programs contributed 17% of the $165 billion, up from 13% in 2019. So there has been an increase of government-sponsored programs, and you can see that. For example, Virginia, which is state, we'll get into the difference of how the program's actually covered. Adult Medicaid dental benefits are 90% covered by the federal government under the Affordable Care Act. Only 10% of Medicaid dental benefits are paid for by the state. So I think that's a very important thing to keep in our minds, as this is much, much, much more a federal policy. But in this example, Virginia allocated $282 million for dental procedures over 2022 into 2023 after it expanded its Medicaid program in 2021. So, and just doing rough math, if Virginia spent $280 million on Medicaid benefits, that means the Fed contributed $2.8 billion to their dental benefits, as that would be a 90% increase over that number. So another thing really to keep in mind is also into that spend you have Medicaid, but Medicare is so much bigger than Medicaid. And now with the Medicare Advantage plans, they actually will cover dental procedures. So in 2023, the national dental expenditures were $174 billion, about an increase of $10 billion year over year. That decreased, though, down to 3.6% of the country's total healthcare expenditures. So again, dental is such a small piece of this pie. But you have government programs including Medicare, Medicaid, Children's Health Insurance Program, or CHIP, Department of Defense, Department of Veteran Affairs. They have been increasing their dental spend. Between 2022 and 2023, government spending on dental care rose by 18%, largely due to a $3 billion increase in Medicare dental spending and a $1 billion increase in Medicaid dental spending. So 75% of that increase went to the supplement plans of Medicare, not Medicaid. So again, another important factor to keep in mind, because enrollees pay additional money for those Medicare Advantage plans. So it's not like, again, it's giving out free dental care. Those members are paying for those additional services. So I think that's really important to keep in mind. And then when we look at how much it could cost us taxpayers if we get rid of the adult Medicaid, this is just Medicaid, not Medicare, but if we just get rid of the Medicaid adult benefits, it is going to drive dental issues to the ER. And as we all know, dental issues in the ER are extremely expensive. On average, the US already spends $2+ billion per year on ER visits for dental related issues. And again, the problem with going to the ER for that is it's just pain management. You're going to get maybe an antibiotic, maybe a pain management relief from a prescription, and that is it. They are not going to remove that decay or get that infection out. In almost all scenarios, you're going to get a referral to a dental office or an oral surgeon. And so what you just spent really doesn't go far at all, because it hasn't addressed the actual problem. So when we look at that, that's $2 billion right off the gate, that it's going to be moved at least to the ER of spending. So again, that number's not going to go away. It's just going to move buckets. We already know dental is only 3.5% of the total healthcare spend. So you can take us down to 3 or 2%, but it's just going to move that needle into the hospital setting every single time. So you not only have the increase of the ER visits, but you also have higher costs for chronic disease management, Poor oral health is linked to diabetes, heart disease, stroke, and those are very costly to treat on a long-term basis. Untreated gum disease leads to higher medical costs for diabetes patients, and an average diabetes patient costs the government $2,000 to $3,000 per year per patient to keep their diabetes in a healthy order. And obviously cardiovascular conditions worsened by oral infections, and that expense is massive. You also have workforce and economic impacts. So dental problems, obviously the patient's going to experience pain, difficulty eating. It's hard to do a good job and be productive when you're in pain. And there's a lot of studies out there that poor dental care can result in higher unemployment, a loss of confidence with a loss of teeth, not being confident in your smile, keeps people away from interviewing, and there are a lot of soft benefits that unfortunately pull through on the negative side. And then you also have increased cost of Medicaid and Medicare later. Preventative dental care is by far the cheapest form of healthcare. For every $1 spent on preventative oral care, the healthcare system saves an estimated $10 to $50 downstream. So I think just stuff that we want to keep in the back of our minds, because we know the Medicaid spend doesn't get much higher than 20 to 30 billion per year. And we have, just on a rough conservative study, the increase of US healthcare costs would increase by at least 10 to 20 billion dollars annually if we got rid of the Medicaid dental benefits. So comment down below. I know I threw a ton of numbers at you. I'm going to upload this video to the blog post below. And again, comment, read through these numbers, but I'm fascinated to see how small of a spend dental is overall. And also, sometimes it seems nice, quote unquote, capping or cutting Medicaid dental benefits. But again, when people are in pain, they're going to go and have those issues addressed. And that money is just going to move to a different bucket. So comment down below. Let me know what you guys are interested in learning more about. And I hope you have a great day.